Hi everyone, today we have Dr. Atsushi Tanaka from Japan. He's one of the experts in the field of ROSI, round spermatid injection. He's here today just to introduce about the technology and let us know about how many cases has he already have. So please introduce to us your technology.
Yes, thank you very much for the interview. So in 1993, Dr. Yanagimachi, a Japanese basic researcher, reported the first successful case that showed possibility the round spermatid to be fertilized with oocyte. And next year they were successful to get newborn mouse. So in 1996 in Tesari et al., they reported the first successful case in human beings. But very few cases of deliveries. So about 2000 years, many people started to become doubtful whether this ROSI is effective for clinical application, and then gradually disappeared. But I've been doing this ROSI over 20 years, and I have more than 500 cases of successful boy or girls. Now, the oldest one is now over 20, and he had a baby. So myself, I'm confident this ROSI is a very important technique for rescue the of selective Azoospermic men who have testicular sperm. So maturation arrest at the stage of round spermatid, or even if they have testicular sperm, but all of them are dead, or they have head abnormality. In such a case, so ICSI is not variable. So in such case, we use the round spermatid instead of poor sperm or late stage spermatid. Of course, we have very good sperms or late stage spermatid we use, of course.
Yeah, it's good you mentioned about that case where, like now, one of these child from ROSI has already have a child, so that means he's fertile. So we make sure that this technique will not at least alter the new generation. This is a really good thing. And you mentioned you have already 500 cases, which is really good number. So you mentioned yesterday in your presentation, or one of your colleagues, that you're using BLC zeta. So is this improving the fertilization rate, or?
Honestly speaking, it's not increasing. So now we are always worrying about why the success rate is stopped increasing. So there are two problems. One is also activation is not perfect. So far we use electrical stimulation, but now we are changing to use PLC zeta. It's one kind of phosphate pathway, and also iodine plus puromycin combination. So now we're looking for which one is best. And second problem is now I'm very interested in the epigenetical abnormalities, because when we immunochemical histological staining for the nuclear maturation and the histone maturation and accentuation, we found that epigenetical abnormalities are frequently found. So we are now looking for the frequency, and next step is how to treat these lack of the abnormal epigenetical problem.
And that's a good approach. But one last question: how successful is ROSI so far? So what's your success rate?
Yes, totally about 9%, including fresh and
Are you
frozen.
talking like about live birth?
Yes, live birth.
9%.
Live birth, yes,
Really
yes.
good. Thank you again for for like speaking with us, and I really appreciate that. Thank you very much.
We welcome you, everybody who are interested in the ROSI. I will show everything we have acquired through my 20 years experience.
Thank you very much. We appreciate that. Thank you.